All right. All right. First thing we're gonna do is take out scissors. I need scissors. They used to come with, kits used to come with these droppers. I have no idea why. Anyways, I need pins, lots of pins. So I'm gonna do the same thing, dump out all the pins. All right. With me so far? Okay. Now notice I'm only wearing one glove. I'm gonna show you why in a second. We have the worm, and we have the head end here, all right? That's the mouth. We have the clitellum, which is the fat part right here. And that's the, basically two worms. Give me your worm. Worm, give me your worm. Just hand me the worm. Okay, that works fine. Okay, so when they mate, they actually go head to tail. Kind of, there's a number between 70 and 68 that, okay, good. Can I get it up there? Right, yeah, you gotta hold it. Stand up. You are killing me. I don't want to have to take two here. Yeah, watch there. So they're gonna mate kind of clitellum to clitellum, and what they do is they actually, some slime or mucus comes out, and they wrap around that area, and that lines up all their genital pores. The hermaphrodite, what are you doing? Focus here, dude, focus. If I don't like this, I swear I'm coming back to haunt you. And I'm close to being dead. I can do that in a few years. So they basically will form a mucus thing around them. It lines them up. You know, they're hermaphrodites. They have both sexes inside of them. Here you go. Here's your one. Don't want to touch it. All right. So you have the mouth. You have the clitellum, which is on your list. You have a genital pore, which if you look down, and you can actually count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 segments down. You'll see the segment has a little hole in it. That's the genital pore. And then, of course, at the other end, you have the anus. Does that make sense to everybody? Yes, no? Okay. What we're going to do is use the scissors to cut them open, not the probes, because these are a little tougher skin. But what you need to understand is I don't want to cut down. Like, I'm going to cut this glove off. I don't want to cut down into my hand, so I want to cut just the glove. Does that make sense? So I'm going to lift the skin. I don't want to dig down because I don't want to get into the organs. That's why I'm actually wearing the glove, is to show that. So the way I'm going to do it, start with the head. The dark side is up. They have counter shading, like we talked about in the evolution unit. They have a light on the bottom. Not that anything underneath an earthworm is going to go, ooh, it's really light up there. But that's the way they are. They're counter shaded. And I'm going to stick the scissors. I'm going to try to find the sharpest end of the scissors. And all the scissors seem to have a sharp end and kind of a duller end. And I'm just going to take the scissors and stick them into the mouth and go right, trying to keep the point real close to the skin, right along. And it cuts real easy. You can almost just, unzip it like you did the worm. You just need the scissors. Something should not come out like that. And this is a hit and miss. I'm about 50-50 with doing this really well and doing it okay. And I'm going to get down. All you have to do is go down to about the half-inch past the clitellum. And that's it. All right? All the rest is the same. You can do the rest, just a waste of your time, waste of your effort there. And then I just start pinning it open. I pin open one side. Now the thing is, okay, you have the worm, all right, and all the sides are attached. There's actually tissue that supports the sides. And we have to scrape that tissue out so we can open it up. To do that, I'm going to use a pin, and I'm just going to take it and kind of scrape it so that the skin opens up. So I kind of just scrape. When I get far enough, I'll put another pin in. Okay? Take another pin, try to get so you guys can see. Scrape it all the way up to that point, put another pin in. Get that pin out of the way. Same thing up here, just kind of put the pin in the side and scrape it. So basically what I'm doing is scraping along the side right here. All right, so that it opens up. Does everybody understand that? Okay, I'm not going to show you the parts. All we're going to do is get past this, and if we get done with this today, then I'll go over the parts of it in a few minutes. So I've got kind of one side done. Now I just need to do the other side. To do the other side, it's the same thing. I'm just going to take it, open it up, put a pin underneath, the skin and scrape the septa is what you're really scraping, the little dividing things. Put a pin in. And again, notice the angle of the pin. They're not straight up and down. They're really wide, so that when you do want to look at them, you can see it better. So I'm going to take another pin, pull the side apart, and just run it along the side, just inside the side here. See, when I scrape it like that, it almost opens up automatically. Put the pin in along the side, and I'm just tearing the little separating. And I did not do a bad job. I'm impressed. For having not done it for a year, I did okay. Scrape it along the side, open up. The way I really tell if I did a good job, this black line, which is the dorsal blood vessel, should be right on top, which is pretty much what I did. And you can see the septa right there, which I don't think I'm going to scrape because I'm going to leave that one full. And so what I have is the septa, and that's what I've been scraping, those little teeny dividing things. And as I scrape them and tear them, that allows the skin to open up. And then like this area needs to be scraped a little better. And when you're all done, it lays flat like that. I could probably open up the mouth area a little bit more to see the pharynx. And that's a dissected earthworm. Does that make sense to everybody? Can you handle that? All right.